We have done a patient-level meta-analysis regarding a new signature called POLAR, and POLAR can identify patients benefiting from radiotherapy. And the POLAR was developed within the SWE-BCG91RT trial, a trial where patients after breast-conserving surgery were randomized to radiotherapy or no radiotherapy to the breast. And we have collected all the blocks in that trial, and we also have long-term follow-up. And in the training part of that cohort, we did define this POLAR signature. And now we have made a patient-level meta-analysis, including 3 different trials in the meta-analysis. The validation part of the SWE-BCG91RT and the Princess Margaret trial in Toronto, and also the Scottish Conservation RT trials. So we have we have tested the performance of the POLAR signature in all these 3 studies. The methodology was that the objective was to look at the performance of the POLAR signature to prognosticate locorenal failures, and also to examine the performance of the POLAR signature to predict RT benefit. And we combined all these 3 trials, and we could see that in the POLAR high patients there was a great benefit of radiation, and in POLAR low it was no benefit. And in the POLAR low there was in the new RT arm a very low risk for locorenal recurrences. So POLAR both prognosticate the risk for locorenal recurrences in the group without RT and can also predict the benefit from radiation. I think it's an interesting finding that we have found a genomic classifier that can predict RT benefit. I think that this classifier must be further validated in contemporary new studies to go into the clinic. But as far as we know, this is the first predictive classifier regarding RT benefit. I think these results give possibilities in the future to omit radiation for many of the patients with a low POLAR score. The test must be further validated and streamlined before going into clinical practice, but I think we got a possibility here to select patients for radiotherapy and also to safely omit part of the patient for breast radiotherapy.